I always get to this point and then somebody reminds me and say, oh yeah, I can do that. Okay, it's being recorded as we speak here.
All right, wonderful.
Okay, let's go ahead and get started. Like I said, I'm going to go through this kind of quickly. I'll pause for questions as we go through the different sections here. But if you do have any questions, please feel free to interrupt me. Okay, VMSG dashboard, just some quick overview. It was developed specifically for public health with public health. So we've been working in Arizona with public health since, 2001, I think. And I had a lot of work on operational planning and such. And the health departments here, the state health department and Maricopa County, who's the third largest public health jurisdiction in the nation, needed to be able to do some operational planning and execution. This is long before FAB came about. So we started developing the system with them. So we took the kind of the expertise that they had and our expertise in development and put it together here. Basically, the VMSG dashboard is an operational planning and execution system. So developing the plans, and you got any number of plans in the system. You're going to have what FAB calls their 6-pack of plans in there. So your strategic plan, your CHIP, and your CHON, that sort of thing. In addition, eventually you should have plans for each division, each office, each program. And those plans then are kept dynamic through the PDCA cycle, or in our nomenclature is plan, do, check, and adjust. We're going to go into all this in great detail. 2011, FAB came along, and Maricopa County initially went in for FAB accreditation, and the system that they had, our system, was fully demonstrated, which is the highest level of compliance by FAB for standard 9.1. And one of the reasons is that there's a requirement that you involve the entire department in the operational planning portions of and performance management. So what we did is we developed this thing we call real-time planning, which is, you guys have seen it already, is the email notifications that come out asking you to go back in the system and do updates on the specific activities and objectives that you've been assigned. And again, we're going to talk a lot more about that here. But what that does is involve everybody, including your external partners, to be able to keep the information up to date in the system so that you can actually use it. Performance management, kind of 3 steps in public health. Number 1 is that operational planning. So developing a set of plans. Most people start with what you see up there in the bubbles, which is the FAB 6-pack of plans, and then they grow into the rest of the department over time here. After you've got the plans in place, and obviously you're going to execute the plans, and you want to have tools to be able to monitor them at the highest level, the department level even, all the way down to what we call the micro level, which would be a specific activity. And then the ability to share that information with the public through the VMSG public interface we'll talk about here. And then the PDCA cycle, and our nomenclature is a little bit different, we know, but plan, do, check, and adjust. So we're going to go through this in detail here. One of the things that we did from the very beginning is we worked with the folks at Arizona State University here to kind of congeal this model together, this planning model. And this came out to be kind of the best practice, not only in public health, but through, like I say, Arizona State University and how they looked at operational planning. So if you imagine this pyramid being, getting more and more detailed as you go down, at the very top is the organization. So it's the health department. Underneath that, you see the little org chart here, and that is typically the organizational structure of your department. So, where does community health report? Where does emergency operations report? That sort of thing. In addition, you're going to have your primary plans, again, what we call the FAB 6-pack of plans, at the highest level, at the group level in here. Underneath each group, then, there's a set of services or initiatives, and these are just the big buckets of things that are done within that particular group. And then under each service initiative, you have a little plan that includes the goals, which include the objectives for the goals and the activities for those objectives. And like I say, we're going to go into great detail in a live environment here. So we have this little demo organization we call USA Public Health, and I will take you over there live now. So I'm sure that most of you have already seen this. If you don't have a login in the system, by the way, just contact me and I'll get you set up in there, show you how to log in and get started in here. But when you log in, especially if you're an organizational admin here, you're going to see all of these bullets on here. But the one thing to focus on for now, if you don't mind, is these navigation tabs across the top. And if you look at them, it's the same as that pyramid I just showed you, flipped on its left side. So the organization is your health department. Underneath that, you'll have the groups. Each group will have a set of services, each service set of goals, objectives, and activities. I'm going to go down to my groups tab here. So I by default went to community health. So when you are assigned as a user, you're assigned to a default group. So if you're a community health person, you're going to by default go to community health. If you're an HR person, you're going to go to HR. And if you're in the highest levels in the department, you're typically going to go to the department level to start with here. For now, I'm going to go down to this little subgroup called Tobacco 2022. And you'll notice the group levels out here. They start at 1 and go down through 10. I don't think anybody's ever gone past 5 or 6. But the 3-level groups report to the 2-level groups. The 2-level groups report to the 1-level group. So you can get that hierarchy going down there. Now, underneath the tobacco group here, I have a set of services. Services, again, are just the big buckets. What do we do in this group? So tobacco cessation is one. Secondhand smoke might be one. Tobacco initiation prevention might be one. So we're going to use this example going forward here. Under each of these selected services, you have a set of goals. So in this case, the goal is reduce smoking in high schools for tobacco cessation, reduce smoking in colleges, reduce smoking in public areas. So these are just 3 of the kind of the high level goals. Goals are typically this simple. Action verb followed by a couple of words just saying this is what we're trying to accomplish without a lot of specific detail. As we get down to the goal level, you're going to notice we have these traffic lights out here, and there's actually 4 of them. The green, yellow, red, and then we have what we call the gold bar. And these are really nice, if you use them properly, they're just nice visual indicators. If it's green, you typically don't have to worry about it. It means it's moving forward as expected. If it's yellow, you might have something coming up that's going to cause an issue. I used the example of 2 years ago when this thing called COVID came about. Nobody really knew what it was, but you realized it was going to be taking up some resources. You might go into there and say, hey, we're going to put a note down here in the notes and comments saying, this new thing called COVID's come about. Looks like it's going to take a lot of resources. We may have to put this plan on hold for a while. Red would be, maybe a year ago when you're deep involved in doing vaccinations and whatever. A note down here might say, COVID has struck. We're got all resources dedicated to doing COVID. We're going to have to put this on hold until this COVID thing is over with. The gold bar indicates successful completion of this portion of the plan. You'll see it at the goal, the objective, and activity level all. Now, in this particular case, reduce smoking in high schools is probably never going to be fully completed. It's something that's going to be ongoing, so it may never get past green. If this said, develop the department's strategic plan, that would be completed at some point in time. You might mark it as gold when you get that plan completed, but some things will be gold, some things won't. It's kind of a judgment that you make on there. So underneath this particular goal of reduce smoking in high school, we're going to have a set of objectives, and these are what we call SMART objectives. So they're specific, measurable, attainable, realistic, and time-based. So as an example, reduce smoking at Wayne High School by 25% by the end of the school year. So what we've done is set a very finite target as to what we're trying to accomplish. In order to get us to that target, we're going to assign this person, we call an objective lead. And if I go up here and say show all users, I'm going to show everybody in my little department here. And what we're looking at here is saying that Steve Hansen is the person who's going to guide us to get to this particular objective. Steve is a program manager, project manager, something along that line. You can obviously select anybody in here that you want. Now, this is one of the people who will be getting that email notification on a regular basis to update the status of this particular objective in here. So now we have this particular objective in mind. How are we going to get there? And that's what the activities are all about, or the operational portion. In this case, it's going to be a specific set of steps that we're going to go through that we believe will help us to accomplish that objective. So I'm going to walk through these 3 activities that we've selected, and I chose these 3 activities because they represent the 3 different types of activities in the system. The first one here is a project-based activity. Project-based activities, by the way, were the initial only type of activity in the system years ago, and then the other ones were added, based on things that we saw and requests from health departments in here. The project-based activity is still the most common. It's about 85% of everything in the system. The definition of a project-based activity is pretty simple. You're going to have an activity statement over here that says we're going to create training for students and faculty. We have a performance metric, and what that says is how do I know when I've successfully completed the activity? So once we're creating training, once we've created the training, we know that we're done with that particular activity. Every activity has a beginning and ending date, so this is when we're going to do it. And in this particular case with a project-based activity, it's measured in % complete. So if you go down to the notes field, the person who was actually managing this put down in here completed chapter 1. At that point in time, this was probably sitting at 25%, chapter 2, 50, 75, and 100%. So what you're doing is going through the history and saying, whenever it was at 25%, we completed chapter 1. So that's the project-based activity. Every activity has also got a team of folks assigned to it. Click on this little pencil icon here, and I'm going to open it up to the whole department again. So in this case, you see that we have Steve Hansen and Andrea shown as team members. So these are the folks who are on the team to complete this activity. We have assigned Steve Hansen as the team lead, as well as being the objective lead. He's also the activity lead in this case. And then this flag out here called email. The email notification is part of that real-time planning. Steve is going to get an email on a regular basis, typically monthly, but you can set up whatever you want, typically monthly, to go back in and keep this activity up to date. So in this case, how are we doing creating the training content? This is where you go in and put in that 25%, 50%, 75%, or whatever. The other thing you have over here as an optional field is FTE, your full-time equivalent. And what we're showing over here is what is the resource required to complete this activity. So in this case, we're estimating that Andrea is going to spend about 30% of her time, and then Steve is going to spend about 10% of his time. What we do with that is a couple different things. But number one, at the activity level, we can roll it up and say we have about a 0.4 FTE to complete this particular activity. If I look at all three of these activities rolled up to the objective level, it's about a 1.0 FTE to complete this particular objective here. So it just gives you the ability to determine what the human resource investment is or is going to be, or in the future, you can go back and say, this is what it actually was. So you can look at resource investment, that sort of thing. Now back to our activities. In addition, you have the ability to assign external partners. So in this case, we have an external partner, a VMSG dashboard, and Fred Erickson is the contact name. The administrators have a database that they can manage off of the main menu, which is the partner database. You can have as many partner organizations as you want, and each partner organization can have as many contacts as you want in there. If you choose to, you can make these partners as system users, and when you do that, then you can assign them that email notification flag. So what happens is your external partners can actually go directly back into the system in a very limited environment and update the particular activities. So you think about having your community health improvement plan out there, you probably have a lot of external partners involved. Instead of you calling them up and saying, hey, on this activity, you are going to be helping us to create the training content. How are we doing on that? And then you have to go back in, log into the system, and update that information. We can short circuit that whole process. Email goes directly to the external partner. And by the way, we'll train them on how to respond. It's a pretty simple process, and we'll do that at no cost to you. They will then respond directly to the system and update that information. So it short circuits the process and keeps you from having to be in the middle at that point. So that's the first activity, is we're going to create training content. Our second activity is we're going to take that training content and provide 9 training sessions each month on the dangers of smoking to students and faculty. Now, every activity has got a little wizard here to help set it up. So I click on this guy and it pops up a little wizard here. This particular type of activity is called a quality assurance activity. The difference here is a couple of things. Number one, it has a beginning date. You see there's no ending date because it has a frequency. Frequency is how often are we going to do this? So you can see by the activity is we're going to do 9 training sessions monthly. So we've selected a monthly cycle here. The other thing we do on this particular type of, and by the way, every time I go in to update this information, it's going to give you a little dialogue. It says, do you want to update the beginning date? Sometimes you do, sometimes you don't, depending on where you are in the cycle here. The other thing you can do is automatically set the traffic light based on the values that you've put in there. So we're looking for 9 training sessions a month. If we're greater than or equal to 9, it's going to set that traffic light to green automatically for us. If it's less than or equal to 6, it's going to set it to red. If it's in between, it's going to set it to yellow. And then we have down here, metric type is training sessions provided. So what you'll notice is the performance metric is auto-generated. So in this case, it says training sessions provided, measured monthly, green, yellow, and red. So this particular activity is unique, again, in that it repeats over and over and it automatically sets the traffic light. Then the third activity down here, we're going to do in parallel, is we're going to contact all 20 tobacco vendors within 1 mile of Wayne High School to assure they're not selling to minors. And again, we go to our little wizard over here. This is called the quantitative measurement, a QM activity. The uniqueness here primarily is that you're measuring quantities instead of percentages. It'll calculate the percentages for you. So if you're doing anything where you're counting something or dollars or anything along that line, use this type of activity. Again, beginning and ending date. a target number in here. So I've set the target of contact all 20 tobacco vendors. I've got that in there. I can say it's either decimal or dollar. So when you're doing grant management and different things like that, you'll use this type of activity for dollars. Metric type is tobacco vendors contacted. Down here, we have data entry types. There's two options. The default is enter a value to add to total. So in this case, we're doing this over the course of about 3.5 months. So every month I'm going to go in and say, how many tobacco vendors did I contact this month? I'll put it in here. It's going to add to the total and calculate the percent based on the target number of 20. If I'm going to do all this in, let's say 1 month, I'm just going to go at the end of the month and put in, 20 vendors or whatever it happens to be. I can say enter a new total value. And that way it's not going to do any calculation for me. It just knows that I'm entering it at one point in time here. So that's the three types of activities in here. And these are the three activities that we believe are going to get us to the objective. Now, if we go back and look at that in the pyramid, it looks like this. It was under the group Tobacco 2022. The particular service that we selected was tobacco cessation. Under that service, we picked this goal. Under this goal, we picked this particular objective. And then the activities that we believe are going to get us to that objective are right here. So that's the operational planning process. You can go right through and develop a plan in the system exactly like that. You start out and say, okay, what are the big buckets? What are the groups? If it maybe all be under one group, or under that group, what are the big buckets of things that we're going to provide? What are the services that community health provides? What are the services that emergency operations provides? That sort of thing. And just build the plan out till you get down to those specific activities. Now, once you have the plan in place, you're going to be able to monitor the plan through this PDCA cycle. So what we just did is the P part. We've got the plan in place. Next thing we're going to do, obviously, is execute the plan. So we're going to create the training content. We're going to take that training content, go to the schools, and actually do the 9 training sessions a month. And in parallel, we're going to start contacting tobacco vendors. So that's the do phase we're executing. This is where that real-time planning comes in. During this period of time, let's say over the 3 or 4 months that we're doing it, those email notifications are going to go out to those folks who are assigned as the activity and objective lead. They're going to be asked to go back in and update the information in those particular activities and objectives. And the reason that's critical is because if you have a plan out there and it's never updated, you're never going to be able to track the plan. So you don't have any performance management, if you will, at that point in time. That's why the real-time planning is really critical in there. Now, one of the things that will happen is you'll have some people who will dig right in there and do the real-time planning updates, and some people who will put it on the back burner and maybe not get it done. We'll show you in a few minutes when we get to the dashboard screen exactly how we monitor or audit that. So now we're going to be going through the do phase. We're going to be executing. Every couple of months, I might want to go in and say, how are we doing on this particular project? So I'm going to go back into here. A lot of times you're going to be measuring that at the objective level because, again, that's our target. So the first thing we can go down and look at and say, okay, we're at a 25% reduction. Hey, that's great. That's what we were targeting, right? The other thing I might want to look at is say, how did we do that over time? So I can click on the little chart here. Shows that when we started, we were at a 0% reduction and we ramped up and got to our 25% reduction. The nice thing about this is it says that we got to our target. Our target was 25%. We made it. So the plan is working beautifully at this point in time. Now, back to the PDCA cycle. After you do the check phase, that's really all there is. If you're collecting all the data in the background with the real-time planning, it's that easy to do the check. Now, we're going to make the adjust phase. In the adjust phase, if necessary, you're going to make adjustments to correct or the plan or the resources and get back in line here. In this case, everything's working beautifully. I'm not going to change a thing in the plan, continue the execution process. Maybe once a month, I'll go in and hit the check phase, look at the chart, see we're still at 25% and continue on. Now, I'm going to give you a different example here. Reduce smoking at Desert Vista High School by 25%. So basically the same thing, different school. So first thing I look down here, it says we're at 21%. Let's go look at our chart and see what happened over time. Ramped up, got to 21% and capped off. So something happened that is not allowing us to get there. At this point in time, we don't know what that is. So we're going to go down and dig down into the activities and try to figure that out. So the first thing we have is create the training content. We've got a gold bar there. So I don't even need to look at this one. It says it's done. We're good. We're good to go. Create 9 training or provide 9 training sessions each month on the dangers of smoking. Got a red light there. That's going to concern me. I'm going to go down to the notes field. It says training slowed due to COVID. Okay. Remember, there was a time when all the students were learning from home. So we had a training that was going to be done at the schools. We can't get to the schools. We can't do the training. Okay. Kind of makes sense. I might want to take a look at my chart here. Say, okay, We started out at 0 at the beginning of the program, got up to 9 training sessions a month. Then this thing called COVID hit, and people were starting to learn from home. We didn't predict COVID coming, so we had a in-person training built up, and we don't have a way to do it at home. So we started dropping off on our training, got down into the red down here. So definitely one issue that would affect our success on the outcome here. The next one says, going to contact all 20 tobacco vendors. Again, we got a yellow light. Difficulty contacting vendors due to COVID restrictions. Okay, makes sense. Go back up to our chart. We ramped up, we got up to 14, 15 vendors and never got to those other 5 vendors. So, there could be something going on in the background with those folks that they're still selling to minors or something that's, causing an issue with us. So between the training sessions not being provided and not being able to monitor the tobacco vendors is probably what's causing our issue at the objective level in there. So now back to the PDCA cycle. At this point in time, we're probably going to want to make adjustments to get back on track. A couple of adjustments that you can make. Now, depending on the situation, we have this COVID thing out there. You're probably not going to be able to apply additional resources. Maybe not. Maybe not apply additional resources to get to that 25%. So let's make it a successful plan. Let's take the plan down to 21%, knowing that at the end of COVID, we're going to be able to get back on track so that we can track the plan at 21%. So we're good there. So the other thing we might do, if we could, is adjust the resources. So recall we had a face-to-face training that is not working because we can't get face-to-face with anybody. Maybe we can just take that training and make a virtual training process out of it. Go to Zoom or whatever it is and build training so that we can now get to those students while they're at home learning, and the teachers as well, and adjust the resources to get to that point in time. So we're either going to adjust the plan or the resources or a combination of both. So those are different adjustments that you'll make in this PDCA process. Every plan is going through this cycle all the time. You determine what the cycle is, whether it's, sometimes it makes sense to do it weekly, sometimes monthly, quarterly, whatever you decide. But you'll just go in there by collecting this information, check, see how we're doing, make adjustments if necessary, keep it going. This is what keeps plans dynamic, which is critical. And it's actually a requirement of FAB is to have dynamic plans as you're doing this in here. Now, the reason I put this slide in here is there's a bunch of other stuff we're going to go through, which is kind of a lot of cases supplemental. What you just saw is the core of performance management. We developed an operational plan. We monitored the plan through its life cycle. We took it through the PDCA cycle to keep it up to date. That is fully active performance management and will get you a fully demonstrated moniker from FAB knowing that. Now, over the years we've been doing this and the 240 plus health departments, we've got a lot of great feedback from those folks on different things that they'd like to see in the system. So we've added those things as we've gone through. So what we're going to do now is we're going to go through and talk about some of the other functions in the system here. But before I do that, are there any questions on what we've gone over so far?
Not over here.
Okay, great. Okay, well, feel free to ask questions as we go through. Let's go ahead and kick on through. Okay, the dashboard itself, kind of the namesake, if you will. Let's go back live. Okay, the dashboard is dynamic based on the group that you've selected. So I can have a dashboard of the entire department. How is the department performing today? Or I can have a dashboard for my strategic plan or my CHA or my CHIP or anything else in here. I'm down here at the community health level. Let's say I'm the community health director. I come in and I'm by default go to community health. I just want to say, hey, how is community health performing today? I can go up here and click on the little traffic light up in the top right corner. What that's going to do is summarize all of the information within community health and give it to me on a one summary screen here. It takes it about 10 seconds to go through and calculate everything together to bring it up. So here's the dashboard screen. What I'm looking at are 3 different areas. The top left corner I call the big picture, and that is just basically the number of green, yellow, red, and gold traffic lights we have at the activity level. I can also look at the objective level. I can look at the goal level here. The other thing I have on here is my schedule gauge, which says right now it says we're 23 days behind schedule on all, the summation of all of the activities in there. Probably not too bad. And the reason it's yellow is because we're not 60 days behind schedule where it turns red, or if we're on schedule, it turns green. So it just gives me a quick summary based on the traffic lights. Now, if I wanted to drill down and look at anything on this screen, you notice I get the little click finger on there. So I can go and drill down on this red activity, find out what's going on, maybe make some assignments to get it back on track and come back to here. So it gives you the ability without having to go navigate through. You can draw on anything on here. Down at the bottom, we have the ability to look at several things. First thing is those activity leaders, those people that we assign as activity leads. You can also do the same thing with objective leads. If you select that, it'll show the objective leads. If I look across here, remember we talked about some people will respond to those email notifications, some people may not. There's an old adage that says people listen to what you say, people do what you audit. This is kind of a little bit of an audit here. What we're showing is the last time this person was in there and updated their information. You notice it's color coded. Green is less than 30 days, which is ideal. You want everybody to be in that area if you can. Yellow indicates it's been 30 to 60 days. Now, it could happen that it just happened to be a transition. Maybe somebody was, when the email came out at the end of the month, somebody was on vacation, so they didn't get it. So yellow is probably acceptable. Red means it's been over 60 days and they haven't updated it. What I might do in this case, if I'm the manager for William, is just go have a little chat with him and say, hey, we need to keep this information up to date. What can I do to help you to get back on track with this stuff? And if it requires training or anything like that, we're happy to do all that for you. The next column here, FTE or full-time equivalent, adds up by person how much they're assigned. Typically, you want to keep people below the 1.0 FTE level here, but if you get somebody who's up like Diane at 1.65, you might want to click on that, look at all of her activities, maybe reassign some of them or adjust some of them so she's not at almost a 1 3/4 person FTE. They are also, the reds and yellows and greens based on how far off they are. Lagging says we have activities that are behind schedule, and the color coding tells you how far. Days is the same as the schedule gauge up here for the individual person. So how are they doing against their assigned timeline? Overdue is the ending date is come and gone, and we're not yet 100% complete. And then the number of red, yellow, green, and gold. So once you assign out the folks to all of the different plans in the system, you can monitor very carefully across here how that person is doing against their plan. Now, I also have the ability to change this first column out basically with groups. So I can look at the divisions, the offices, the programs, and the primary plans in my organization and see how we're performing against those. And then the third one is priorities. This would be the strategic priorities from your strategic plan. And what it does is just compare all the other plans to your strategic plan to see how you're performing, which the strategic plan typically encompasses the entire organization here. So that's the ability to drill down at the bottom here. At the very top on my priorities, these are individually selectable objectives that you personally want to keep your eye on. You'll select them on the objective screen with a little checkbox in there, and they will show up on your login only. Anybody can select the same ones or any different ones that they want. Most people will select reds and yellows up here because they're things that you want to keep your eye on. Typically, maybe somebody who's working for you and you want to keep your eye on these particular objectives up there. So just keep them in there. Again, you can drill down on those and get to any level of detail that you need to. So that's the primary dashboard screen. Now, over COVID, we had a lot of extra time while you guys were out saving the world. And we decided we would take that time and do some of the upgrades that people have been requesting over time. One of those is what we call VMSG Mobile. What that is the ability, that same screen you just saw broken down into 3 phone screens. So you have the top left corner here, you've got the bottom and the top right corner up here. Everything is functionality is the same. You can drill down on anything in here just by touching it. You can do get to the particular activities over here that are yellow. You got the timeline gauge, got everything on here. Now, the one nice thing about this is we've been working with public health for over 20 years and realizing that IT resources are always not necessarily always plentiful in public health. So we built this so it's self-updating. It actually builds the app in the browser on your phone without you having to actually load an app from the app store or anything like that. So when you log in, it's giving you the latest version all the time. And again, you're just going to navigate between these 3 screens to look at your dashboard there. Document management. Don't know if you guys are using this in your accreditation process or not, but we built this in specifically for accreditation. It gets used for everything like grant tracking and everything else. But if you're going to collect up a bunch of documents and go through accreditation or reaccreditation, you got a long timeline. Sometimes just keeping track of where all those documents are that you're going to submit is troublesome. So we built this in that you can attach documents wherever you want to in the system. Typically, they're attached in the accreditation plan at the activity level, but you can put them anywhere you want. And then you can track all those documents so that you know which documents are going to be submitted under which standard measure and that sort of thing. One of the fields that is kind of key on here is this date field. What that is the expiration date of the document. Now, particularly in FAB 2022, they are very, very tight on the dates. Every document has a date range of, the current one, 1 year, 2 year, 3 year, or 5 year expiration date. So what you're going to do is put the expiration date of the document. So when you get down to the time where you're ready to submit documents up into EFAB, you know that they're still valid, or you need to update the document, something along that line. No limit on the number of documents or the size of documents. And they don't have to be documents, by the way. They can be video files or anything that you can take a file and put up there. Reporting, as you get all this stuff together, at some point in time, you're going to want to generate reports on different things. Got a whole boatload of reports in there. The most common one is this first one called an operational plan report. It looks like this. So this is the tobacco program, and it's basically looking down the pyramid. So you got the group, the initiative, the goal, the objective, the activities, the notes, all the status flags, percent complete, everything you want to know but we're afraid to ask. This is the most detailed level of performance monitoring. Get you down to the finite detail. Not everybody wants to see this level of detail. Some people just want to see an indicator of how we're doing on a specific area. So that's why we created VMSG Public. VMSG Public is a way to very simply and interactively create web pages. Each web page has what we call indicator rows. You see 3 indicator rows on this page. You can summarize any level you want. In this case, I'm looking at all the activities under the goal of reduced smoking in high schools. When I roll over here, you can see the number of activities in each status and the timeline. I can build as many indicator rows on a page as I want, so I can scroll forever. So for instance, you might want to have your strategic plan up here. At the very top, you might want to have the group, the entire strategic plan. Underneath that, you might want to have the specific strategic priorities down here, each of them labeled. So you can have a little chart to show you how you're doing against the entire plan and then against each strategic priority. You end up building this unique web address, which is stored up on our servers. You can grab that, hit Control-C and grab that. You can put it in an email, send it out to senior management or whoever wants to see the summary view. You can post it on your public website, whatever you want to do with it. So just a nice, easy way to create a simple view of how the performance is going here. You can create as many of these web pages as you want, as many rows on a web page as you want. Got 2 more short sections to go through. Any questions before we go?
Fred.
Yes.
So I was running a categorization report for our strategic plan.
Yep.
And I was running into an issue where it's not showing all of the activities for certain initiatives. And I was just wondering what you think would cause that.
Well, if it's activities, it's probably that there's not an end date in the activity. There has to be an end date in the activity for it to show.
Okay.
That's the first thing I usually look for.
All right, thank you.
Okay. If you have an example of that when we're done with this, let me know and I'll go dig into it for you.
Okay, awesome, thank you.
Okay. Okay, let's go ahead now. 3-dimensional planning. Once you get a bunch of plans in the system, this is kind of a future thing, but once you get a bunch of plans in the system, you may want to look across everything you've got in a system for things like commonalities, for gaps, for overlaps. How do we perform against the essentials of public health, that sort of thing. So imagine this. Imagine you got this big conference table that you're all sitting at. You got all these plans spread out on the table, and you start looking for a specific thing. Like, for instance, how do we perform against public health essential number 1 in our department here? So you want to look across all the plans to find that. Or how do we perform against FAB standard 6.1 in the department here? Or how are we doing against our strategic priorities and our strategic plan? Or which documents are we going to submit for standard 4.2 up into EFAB? So what this is the ability to categorize pieces of plans. You're talking about the categorization report. That's exactly what this is about. There's a bunch of categories that you can assign, and you can create your own categories to assign. But things like you see in here are already in there. You can go in and assign those. So I can look across and say, for everything we're doing in the department, this is how we're supporting public health essential number 1. So it's just kind of like, I call it once you get those documents all spread out, you got a magic camera on top of them that can look at all the documents simultaneously and pull this information. Realistically, what it is a categorization, subcategorization process. Very simple to do. Obviously, you've already been involved in that based on your question here. Accreditation, reaccreditation project plan. So now give me an update on where you guys stand on accreditation.
So we are using VMSG to to hold or house our documents.
Oh, great.
And we will be submitting no later than November 30th.
Okay, so this is initial accreditation under version 1.5?
Correct.
Okay. Are you using the accreditation plan in the system or not?
Yes.
Oh, okay, great. So you're using a 1.5 plan. We've got both the 1.5 and the 2.0 accreditation plans in there. Let me take you back here. And the 2.0 actually as of July 1 is effective now. But if you go down to the groups here, you'll see down we have the accreditation for 1.5 and 2022. We'll go down and look at the FAB accreditation. Local version 1.5 is the one you guys would have. As you drill down here, obviously you got the 7 steps of accreditation, which you guys are down getting ready for the document selection and submission, it looks like here. Then you go through site visit, their accreditation decision, and then you go through the 5-year cycle for reaccreditation here. Now, if possible, when you decide to go reaccreditation, I would highly, highly recommend going to version 2022. It is so much cleaner, so much nicer, and about 3/4 of the size as far as the number of measures and things. So it's all built into here. Instead of having 12 domains, you have the 10 domains. You have 85 measures, I believe, versus 137, things along that line. And they just did a really great job of streamlining the process. So just an idea when you get into the reaccreditation process. And again, that plan is in there. When you get to that point, let me know and I'll put that plan in your system. But on the plan here underneath there, you have the standards. Now the reaccreditation measures are built in version 1.5. It's a completely separate plan in version 2022. Measures underneath here, and this is where the documents typically get tagged. And then the activities are the definition of the documents, if you will, that you're going to be submitting. So one example dated within 5 years, that sort of thing. So that's the accreditation plan. You guys already obviously have that in there. Now, the other thing that we built in over time was this virtual mock site visit. So instead of I don't know if you guys are planning on doing a mock site visit or not, but what happens is a lot of departments will go in and say they're going to bring somebody, some FAB expert in and review all your documents, review all of your activities and such, and say, okay, yeah, you need to update this, or everything looks great for submission. We can do that virtually now. So with using the accreditation plan, we'll train somebody, whoever you select to do this, we'll train them on how to do this. They can come in remotely. They use this review screen to review every document, every activity in the system. When they're done, there's a report called an accreditation review report. You dump that out and it has all of their notes, their traffic lights, the whole 9 yards on there. So it just makes for a simple process. It's kind of a COVID thing as we started developing this because people weren't able to go out and travel. Training, help, and information. I don't know if you guys have been through the online training that's built in or not, but no matter where you are in the system, so I'm at the services screen right now, I can always go up to the little blue eye and it takes me to what we call help and information. And it takes me directly where I was. So in this case, adding and managing services. First thing is, I call this my little left brain screen. This is like every field and every button on the screen defined over here. Down here is a video module. What it does is takes one of these 5 training modules and it kind of fast forward to the service initiative section. Typically, they're about 5 minutes of video training, pretty detailed on everything you do for services and initiatives. Down here is the complete user guide. Got every detail in there that you want. Typically, it's a hyperlink PDF file, so you can either dock it on your desktop so you can click through it, or print it off if you like that kind of thing. And it's available to you at any time. And then down here, if you haven't already seen this, is implementation guidelines. And what it is a bunch of feedback from health departments for the last many, many years about things that have worked well, things that haven't worked well, IT issues they've run into. There's actually a template in there for developing an operational plan and a Word document, things along that line. So just a lot of different things. In addition, we have up here 5 different training modules. The introduction is what we're doing today, so you can pretty much skip that one. If you want to go into the basics training, I think it's about a 45-minute module that goes over every screen in the system, every button, every field. It gives a really good detail. Operational plan development is kind of a nice one because it has a bunch of examples of what does a service look like? What does an initiative? And it has like a dozen examples for each one, which are real live examples from health departments across the nation. Performance monitoring is all about the charts and the graphs, VMSG public, reporting, all that kind of stuff. And then administrative level video training is for those of you who are designated as org admins to manage the permissions for people, permissions for external users, that sort of thing. And a lot of other stuff in there too about managing partner database, managing the categories and subcategories, that sort of stuff. So it's all available. If you were to start with basics, and let's say you're not an admin, just go through these 3 training modules. I believe it's about 2.5 hours worth of training, but it's extremely detailed. In addition, if you don't like online training, some people don't, we're happy to do live training at any point in time. You determine what you want to do, and we'll set up the training session for you and go through it. One more quick section to go through, but any questions before we go there?
We're all good.
This is a drink out of a fire hose, I realize that. Okay, intelligent real-time plan. Highly, highly recommend that you take advantage of this. And again, probably will require some training. You know, post-COVID, we had a lot of turnover in health departments. So if you got new people who are not familiar with using the system, we're happy to do a real-time training for them just to show them how to respond to the emails. But here's how it works. Most departments set it up on a monthly basis. Again, you can set up anywhere between daily and monthly. Let's say we have it set up for the first Monday of the month. On that first Monday of the month, the system goes in and looks at all of your users who are designated as objective leads or activity leads. And it's going to ask 3 questions. Number 1, have you been in the last 30 days and updated your stuff? Number 2, do you have anything that's behind schedule? Number 3, do you have anything that's overdue? If any of those is true, out go the emails. The emails, as I mentioned, can go to internal folks as well as designated external partners. And again, we'll train all of them. In that email is a link that takes you back into what we call the quick update system. So when you log in, if you've been assigned as an activity or an objective lead, you'll get a dialog that says, do you want to go to the main menu or do you want to go to the quick update screens? The quick update screens, the nice thing about them is that they're very, very simple. Although it looks like a little bit of complexity, it's just the pyramid above it. So it's the group, the service, the initiative, the goals, the activities, but there's only 3 fields that you're updating. The data value, like the number of training sessions we did last month, the traffic light, you know, the red, yellow, green, or gold, and then the notes field, if you got something you want to put in there. Then the little button on the bottom right corner takes you through all of them that you've been assigned, takes you to your objectives that you've been assigned, and you're done. Just to give you a metric, across all the health departments using the system, this averages around 3 to 5 minutes per person per month. So obviously it depends on how much digging you have to do to update the information, but most people who are the activity leads are the people who are doing that every day. So it really is a very efficient, simple process. And what it does is give you that information that you need to perform that PDCA cycle. If the information is in there, you look at your dashboard screen and see it's all green, everybody's up to date, you can count on that information being real. You can make your decisions based on that. This is what that email comes out if you guys haven't seen it already. That's the 3 criteria: 30 days behind schedule and overdue. Just kind of an FYI, for everything you've been assigned, here's the traffic light status. I don't know if we set these up for you guys or not, but it's a very simple process. If you're an org admin, you can go in and say, for each org admin, you can set up a set of groups that they are responsible for. And then the names will show up down here. So you got the name, email address, and phone number. And this is just, hey, I don't know what this email is all about. I don't, you know, it's not working as I expected or whatever. So they can contact somebody. And then there's a link in there. You click on that link. It takes you into the login screen. I'm going to assume that everybody is at this point is logged in, but you're going to log in. There's a send button on the initial screen. It says, send me my email or send me my login credentials. And you put in your email address, hit send again, send your login credentials. From there, then you can go back in and change your password, that sort of thing. Log into the system. If you want to go through the online training, it's all available in there. This is what that credentials email will look like. It just says your user ID and your password. And typically the password, when you first get it, it's going to be some crazy cryptic string that you don't want to remember. So just go in and little key button, you can change the password. VMSG Mobile, one of the big things that people were asking for is the ability to do those updates on your phone. So you don't have to be at your office logging in. If your job is to be out in the field, you get the email, you can do it, sit down for 5 minutes and do all your updates on your phone. So it's right available there. That was it. That was the drink out of a fire hose for the day. What else can I show you? What else would you like to see? And like I mentioned, if you want to dig in deeper into any of this stuff, we'll provide as much training as you need to move forward.
Fred, I have a question. So for the project-based activities, when it comes to and you probably said this, when it comes to the percentage complete, is that just something that like we determine and just like add in? Okay.
Yeah, it is a bit subjective, but like the example I showed where we're actually going through developing the course content, it was 4 chapters. You can kind of figure out that each one's about 25%. And it's not necessarily critical that it's that accurate, depending on obviously what you're tracking in there. When you're trying to get something from 0 to 100%, you're kind of measuring along the way. When you get to 100%, you say, we are done with this particular piece of the project.
Okay. And then my other colleague who's been utilizing VMSG quite a bit, and I was wondering too, if there was any way for like when you're in VMSG and there's like the wizard and the graph icons, like if at any point VMSG would be interested in like adding in when people pan over those icons, like it kind of tells you what it is.
Yeah. Let me give you the history on that. It used to be that way. We developed it that way initially. The background server software that is used had an issue that when you would roll over specific ones of those, it would shut down the system completely. It's for everybody. And so we had to take those out. They're working on it right now. And the company's called Claris. And they're working on that. As soon as they get that resolved at the server level, then we'll put that back in. Yes, that's a great. It was a great feature. Had it everywhere. Everywhere you rolled over, you had a little box. It popped up. So that's what this is for. Unfortunately, when the box popped up, the system shut down. So it wasn't such a good thing. But we are working on that. And as soon as the server company gets that taken care of, then we'll get that rolled back out.
Okay. And going back to my first question, I did not have a lot of start and end dates and things, so I'm adding those in now.
Oh, good. Okay. Yeah, the end date is critical. You don't necessarily have to have a start date, but in order for an activity to appear, it's looking for a date range. And if there's no date to compare it, it just says, obviously, the activity is not active.
Okay.
Well, as you guys are getting into here, if you have anything that you'd like to actually get some help on developing a plan or entering a plan, please reach out to me, send me what you have. We talked about your newest strategic plan, getting that in there. I'm happy to help get it started and then open a go-to-meeting and walk you through the process of finalizing it. And it really works out well that way. The reason it works out so well is because you're working on your own plan, and it really does seem to help to connect to it. So we're happy to do that as much as you want.
Okay.
Any questions from the other folks that are on?
I'm all set.
Okay. Well, everybody, thank you so much for your time. I know it was a drink out of a fire hose. Again, the idea is just to understand, what it's all about. Any additional training you want, any additional assistance you want, please reach out to us, and we're happy to provide that.
Great. Thank you.
Thank you very much.
Thanks,
Yes.
everybody.
Thanks.
Have a wonderful weekend.
Thanks, you as well.